Welcome to our webinar on mental health for girls and the people who support them. Good afternoon, good morning, good evening, depending on where you're joining us from. I'd like to ask everyone also to remain muted unless you're speaking, and to hold questions for the question and answer session. Though we will have, of course, the chat and some other ways to engage while others are talking. My name is Eva Roca. I'll be moderating today's discussion. I'm a researcher and consultant who's been working on programs for young people, mostly girls, for most of the last 2 decades. And I've been part of the community of practice here at the Population Council since the very beginning. I'm thrilled to be here moderating this discussion today and to also make space for some of our community of practice members to discuss what I think is one of the most important issues we can talk about, mental health. I have a special interest in mental health because I feel it's a relatively neglected area and critically important for young people, especially girls, and particularly for those who already experience marginalization because of other things going on in their lives. And all of this has only been intensified by COVID, which in most places is an ongoing crisis with not a real end completely in sight yet. So I'd like to thank all of you for taking time out of your day to join us and also to share your experiences, and a special thank you to our panelists. I hope this session will be participatory to the extent possible on a Zoom, and also a space for discussion. Since we'll be covering a lot of ground, we're going to share a link to a Google Doc you can all edit throughout the session. Sam, if you wouldn't mind dropping that in the chat. And we also invite comments and questions in the chat as well. We'll have a breakout session later on where I hope you'll all be able to share some of your own experiences with each other and with us. So I want to orient you to the topics we're going to discuss today. Really, any one of these could be its own webinar, but I hope to give each of you a taste of the topics for now. And I hope it can be an ongoing discussion after this webinar is over, and that some of these discussions will be reflected in your work. So today we're going to talk about 5 things. First off, how we talk about mental health and what it means in our communities and the girls that we work with. How mental health is related to social connections, livelihoods, and community characteristics, the social determinants of health. What are some of the key mental health challenges that girls and the people who support them, like mentors and staff and programs, face? Some strategies that programs have been using to address mental health, both before COVID and during COVID crisis in low resource environments, and innovative ways to measure aspects of mental health. I hope each of you hears something today that sparks further reflection and maybe changes in the way you do your work, or maybe collaborations. So looking forward to seeing what comes next. But before we start the discussion, I just want to mention a few statistics and some broad ideas that we can keep in mind during the discussion. Why should mental health be a key focus area for those who work with marginalized girls? Everyone has mental health. Each one of us on this call is feeling better or worse mental health right now in this moment. Yet it's a neglected and often very stigmatized issue, hidden away and not spoken about. I would say, if it's possible to say that anything positive at all has come out of this COVID pandemic, it's that people are just a little bit more open in speaking about mental health. But while COVID has brought and needed increased attention to the importance of mental health, it has also really exacerbated the stresses for many in a huge way, especially those who are already burdened by other inequities related to their race, their gender, socioeconomic status, and other issues. And I think that's been something that's been made really clear also over the course of the last year. And of course, the pandemic has especially deepened mental health challenges for girls, which are the population we'll mostly be talking about today, also talking about the people who support them. And mental health is especially important during adolescence. As we all know, it's a formative time in so many ways, neurologically, socially, in terms of the transitions that you're going through for setting up the rest of your life. It's a key time, therefore, when programs can make a difference, and that can have a lasting positive effect, helping girls build resilience and coping skills. So just a few statistics. Mental health conditions account for 16% of the global burden of disease and injury in people aged 10 to 19 years. This is a pretty high number. However, it obscures measurement issues, total lack of measurement in lots of places, gender differences, and I would posit that the real number is likely higher than that. Globally, depression is one of the leading causes of illness and disability among adolescents. And depression, of course, is not the whole story for mental health, but it's one of the prominent ones. And it's a key area that we're always thinking about. And then one stark statistic, suicide is the third leading cause of death for 15 to 19-year-olds globally. That's, of course, one of the most extreme measures we can have, but an important one to think about in some communities especially. So mental health is clearly important on its own, but it also affects other areas of girls' lives. Poor mental health is intimately connected to just about every other aspect of life, influencing and being influenced by issues like economic and food insecurity, sexual risk, other relationships, and a long list of things that we really don't have time to do justice to today. But the social determinants of health definitely include mental health. There have been some rapid reviews done over the last year. What have been the effects of COVID, and also drawing on previous crises like Ebola, showing that young people, especially girls, have been especially affected by the confinements and lockdowns that have been a feature of life in many places. This is due to issues like lack of access to school, to friends, increased pressure to marry before they're ready, increased care burden at home, exposure to violence. But as we all know, girls have stresses even under normal conditions that merit attention. I want to briefly highlight this figure, and thank you, Judith, and the community of practice for developing it. I really think it's a nice way of showing the at least 4 vital roles that girls play in emergencies. Oh, sorry, if you could just stay muted if you're, thank you, not speaking. Thank you. So COVID is the emergency at the top of mind for many of us right now, but in some contexts, it's not the only one. It might be overlapping with other challenges like climate change, energy crisis, food insecurity, other diseases, conflicts, poverty, and a whole list of other things. So in crisis after crisis, girls play these key roles, managing the welfare of younger members of the household, supporting the adults and older people in the household, protecting their own security, and playing a positive role as social first responders, really bringing assets to the household that the household might otherwise have access to. But this comes with a cost. Gender roles for girls often become more rigid. Girls experience a higher care burden, and they're responsible for basic service provision for the household, sometimes in ways that put them in harm's way. So clearly this poses many challenges for mental health. And girls who are already facing mental health problems and stresses before a crisis will need even more support when a crisis comes along. But I'd never like the woe is everything framing. So I just want to highlight that girls have also shown incredible strength and resilience throughout this crisis and others. So why are we here? How is mental health foundational? So when it comes to programs for girls, mental health is not a luxury add-on. It's not something you can get around to after you've taken care of all the other things that we know that girls need. It's actually fundamental to whatever you might hope to achieve in a program, because you can't really start building those other assets effectively if mental health is not taken care of first. So you have to support mental health and resilience if you want to achieve other things for girls. So mental health is job one. Definitely not the only job, and I think we all know that from the multifaceted ways in which one must do work with girls. So I wanted to move to introducing our panel and giving them the space to speak. I wanted to share just a little bit about each of them and their organizations, and also to learn a little bit more about who you are, all the people who are joining us from near and far. Sam, if you could drop the link in the chat, I'd like to ask each participant to take a second to respond to the pop-up asking what region you're joining us from. I won't have a chance to look at it now, but maybe during the breakout time, I'd love to see where everyone is coming from. And while you're doing that, I'll just go in alphabetical order and tell you who's going to be speaking today. So we have Diana Bigby. She's the founder of the Fort Belknap Girls Society, which is located on the Fort Belknap Indian Reservation in Montana. We have Kelly Hallman, founder of the Imagine Network, which focuses on Indigenous adolescent girls. We have Christina Malley, the executive director and co-founder of Colors of Connection. Christina is a humanitarian and artist supporting girls and communities in conflict and low resource areas to heal and rebuild their lives through creativity. One tool that she developed for us, the community of practice, integrates creative assets that support social and emotional learning in girls programs. Rima Mortada is a social epidemiologist currently leading the community of practice work in Lebanon. Miriam Narcisse has been leading the Haiti Adolescent Girls Network for the last 6 years. Hagen, which we call it, focuses on building adolescent girls and young women's health, financial, cognitive, and emotional assets. And from the Global Trauma Project, we have Anne Mahinya, the Global Trauma Project's project manager. And she integrates her experience with Girl Roster intentional design into 2 projects in coastal Kenya, one focused on preventing violent extremism and the other on reducing sexual and gender-based violence. And then we have Anita Shankar, who is the senior director at the Global Trauma Project, and she advocates a social justice approach toward health and well-being. So welcome to all of you, and a special welcome to our panel. So this will be the last bit from me, and then I'm going to turn it over. So what do we talk about when we talk about mental health? So here we have the definition that the WHO gives. It's a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, which, as we know, can be quite high for lots of girls, can work productively, and is able to make a contribution to his or her community. So you'll notice that this includes who you are, some individual factors, the social connections that you may or may not have, and those have been constrained under COVID, and where you are. So place and neighborhood, which are often neglected, I think have really been shown to be really critical for our mental health over COVID, when more and more people all over the world have been confined to a smaller space. So I wanted to just give everyone a chance to respond to a poll again. Sam, if you could drop it in the chat, and I hope these polls are working. I'd like to hear the words that you use when you think about mental health. So we've talked about a few issues, but just tell us a little bit about what mental health means to you. And in the meantime, Rima, I wanted to open by asking you, you told me that in your context in Lebanon, and I'm sure this is the case in many places, seeking help for mental health is highly stigmatized. Can you talk a little bit about that and how you get around the stigma issue, what words you're using in your program to make it acceptable and inviting to talk about mental health?
Sure, thank you, Eva. While it's acknowledged that many people in the Syrian refugee community are dealing with mental health issues, especially given all the recent and additional challenges that refugees in Lebanon had to deal with after the political and financial conflict, the explosion, it's triggered many challenges in addition to the pandemic. So it is acknowledged among those communities that there are mental health issues. Many people are dealing with them, but talking about them openly or seeking mental health support is still considered as taboo. Instead, people desiring help would refer to the help as psychosocial support. It is accepted to seek psychosocial support or emotional support. They refer to it using those words. Or sometimes they refer to it help to manage stress and anger. So such words to describe the support are more accepted in those communities. Also, what I noticed that generally people are more inclined to attend group sessions that offer mental health support, which are very common, rather than a one-to-one session, because one, they can relate to problems shared by others as they seem to face common problems. Also, they don't feel as stigmatized when they attend group sessions as everybody is in the same boat. So this is briefly to describe how people refer to mental health and how they seek it, how they refer to it.
No, that's great. Thank you, Rima. And it's wonderful to see the group functioning in so many important ways, because we know it can build those social connections that really help people improve their mental health and improve their well-being, but also ending some of the stigma around seeking help if you know that others in your community are doing the same thing. So very interesting. And I hope that this will be an issue that we can talk about a little bit more in the chats in a bit.
Yes, absolutely.
So I wanted to just highlight a few of the issues we're going to talk about next. So how has COVID exacerbated issues that impact mental health that are especially important for girls? So the three areas that we're going to talk the most about today are social disconnection, some of the economic impacts, and a special highlight on violence, which has a really critical relationship to mental health. So I want to hear a little bit about the social connection factor. So how are the usual ways of connecting? How have those been disrupted? Diana, I'd like to turn to you. You were telling me about your community and a really close-knit community that's been hard hit by COVID. Could you tell us a little bit about what your place is like, where is it, and how COVID has affected some of the social connections there?
Yeah, good morning, everyone. My name is Diana Bigby. Like she had mentioned earlier, I reside on a reservation in Montana. So we are a very small, close-knit community. So COVID-19 did make a big impact on us. We lost a big number of our elders. There are caregivers, there are traditional people that we go to for just different times of need. When we lose someone, we're used to gathering as a community to say our goodbyes, to just do all of that. But when COVID-19 hit, we had a shutdown. We had a complete shutdown. So that meant that we couldn't attend funerals when we were losing people. We couldn't say our goodbyes. So that was, playing a big part on our the impact of our mental health care. So we're used to doing things like that. We're socially gathering people. We have powwows that we have been, doing for many, many years. Our girl society was preparing, for to dance in those, and we were shut down. So we were just staying home. Like, our culture and our traditional things were taken from us because of COVID-19, and that's something that we weren't used to, and our kids aren't used to. And like, for school for our kids, that was online learning and just being away from their friends for months, and that was something that they weren't used to. So we were just trying to find different ways to keep kids busy and focused, and keep their spirits up for being home for a year. Mhm.
Wow, thank you, Diana, for sharing. And I feel hopeful when I hear you speaking in the past tense about some of that, because I hope that means that this is starting to come to an end with vaccine access and things like that. But I know it's been a really tough year, and thank you for sharing. Kelly, I wondered if you had any reflections also from the Imagine Network, any other thoughts about how girls through Imagine have lost those social connections, but in some cases they were just starting to build through programs that were just getting off the ground.
Absolutely. Thank you, Eva, for the opportunity. So the Indigenous Adolescent Girls Empowerment Network works in 45 Native American communities in the US, and we've heard from most of them. And I mean, it's very much along the lines of what Diana just described. Huge loss of elders, not being able to mourn in the traditional and healthy way for a Native American community. Also cultural loss of language, cultural knowledge has been a big deal. But more importantly for girls, I think the isolation has really been difficult for them, because they're used to going to school, they're used to doing things with family, social, cultural events is really the lifeblood of a Native community. And so that has been really hard. But in addition, in many Native American communities, the people coming for tourism, hotel, restaurants, casino, all of that has been just completely curtailed by COVID. And so the loss of income has been very difficult on families as well. And one of the things we were able to do with some of our donor funding is to provide very small micro grants to girl societies in what we call Indian country here in the US. And they have used that funding to help girls in different ways, from basic food supplies to mental health, spiritual health, herbs, plants, other things that people use to pray and heal in a Native American way. Also notebooks, art supplies, things like that. So yeah, it's been really tough. Native American communities have been disproportionately affected by COVID, and things are changing, but it has been an extremely arduous year.
No, thank you, Kelly, for sharing, and Diana as well. You know, I think one thing that is really highlighted to me is both that there are some things that are tough for everyone, not seeing friends, losing family members, and there are some things that are culturally specific that we have to keep in mind. So the loss of powwows, the need to cultivate these spiritual resources to help maintain well-being. So, you know, that's one thing that I hope is highlighted throughout this, that you know, everything needs to be specific to the girls who you're working with and really culturally appropriate, but that there are some things that are helpful for everyone. Thank you very much. And I wanted to mention also just one more place. In places like Lebanon, there's just background social disconnection also all the time because of hostility between the host community and refugees. High mobility, refugees can limit social cohesion there. And Rima, I don't know if you had any more you wanted to say about that, how social connections might be harder to build in a situation like the one you're working in.
Yes, it was already difficult, as you mentioned, Eva, because of the high mobility experienced by refugees, and also because of the hostility between the refugee community and the host community due to competing over limited resources. So the situation was already bad, but now the consequences of COVID-19 and the lockdown intensified, the social isolation. And as others mentioned, it interrupted education. Girls who used to go to school stopped going to school. The few people who used to go to work stopped going to work. People who used to visit each other stopped visiting each other. Also, many people reported the lack of empathy that that started to appear after COVID-19, because apparently the new situation is affecting everyone equally. So Lebanese landlords stopped being patient. They used to be more patient with tenants. Local, members of the host community used to give loans to Syrian refugees. It's no longer the case because the financial and political crisis affected everyone equally. And it was aggravated further by the consequences of controlling transmission of COVID-19. So this is briefly to describe the situation.
Yeah, thank you very much. I mean, everyone on the panel is working in really challenging circumstances that have become even more challenging over the last year and a half or so. So I appreciate all of you sharing. I wanted to move briefly to touching on a little bit more about the characteristics of place and how place can influence mental health. So urban environments have particular features that can negatively affect mental health, densely populated, stressful places. Showing a map here from Goma in the Democratic Republic of Congo. So Christina, you mapped these resources using the Pop Council Community Resource Scan tool. I wondered if you could tell us briefly a little bit about that process and what did you learn about the neighborhoods you're working in there and how these neighborhood characteristics could influence girls' mental health.
Sure, thanks. Yeah, we were able to do this mapping in November last year. And this particular neighborhood, which is one of 18 in Goma, has about 48,000 people. When we mapped resources, we wanted to look for resources and risks and services that would be relevant to girls. And what came up mostly were a lot of things that we couldn't really see being supportive of girls' social and emotional health. So we actually found a lot of brothels along the border of Rwanda. And yeah, we noticed a lot of risks, but it was hard to see spaces that we felt like would be supportive for girls. So as we're setting up this program, I think it's a question for us of how to establish those safe spaces.
Yeah, and tell me a little bit about like what age girls are you working with? Because I always, when I see a map of a community, I think about how each community is different depending on who you are and, you know, your access to that place, what you notice in the place and what you see as there for you. So who are the girls specifically that you're working with?
Well, we, through doing an exercise with the girl roster and then talking about through assets and consulting with girls from our previous programs, we were able to see that working with starting at age 10 is pretty important. Even at that age, the roster was showing that about 76% of girls were off track, so had some level of risk. And so we think in starting at that age, just as they're entering adolescence, is going to be important.
No, thank you. And I agree, very important. And I can't imagine myself as a 10-year-old girl walking around a place with so many brothels, crowding, you know, negative things, and how that would impact my own mental health. So thank you for sharing. Diana, I wanted to turn it back to you for a minute. So you were telling me about how your community is really tight knit and how in a small connected place like that, an issue with one family like sickness or mental health problems, it really affects everyone. And I wondered if you could just tell us a little bit more about that.
Yeah, for sure. So since we live in such a small community, we have more of a, you know, community way of thinking, less individualistic. Always worried about your neighbor or, you know, about what's going on. So we had some issues arising before COVID-19 had hit. We had a lot of people dealing with issues not very good ways, not unhealthy coping skills. So we started to see an increase in suicides in our youth, in our young adults. So we all kind of acted, and we developed the Girl Society as an outlet for the girls. So we were trying to figure out like what age groups to, you know, to work with. And a lot of the issues that we were coming across were, you know, sexual assault, molestation, incest, physical abuse, mental abuse, things like that. So we decided to start at age 8 to 17. It's a big age gap, but the way we have it set up is we have our younger, we call them younger cousins, and then we have like the older cousins, and we, you know, we kind of split them up in regards to what we want to teach them. But so yeah, we reached out to our elders to help with this, and so we started to work with the girls on a lot of cultural and traditional and health issues. Then COVID-19 hit, so we had to regroup, and I guess our focus was on our elders more, because here at Fort Belknap, a lot of our elders are the caregivers of the youth. Just because of different issues, like, you know, the parents aren't in good health, or, you know, just different things like that. But so our focus was on our elders and our youth. So our tribe decided to do the shutdown, and we've been on a shutdown for a whole year. A lot of people were disappointed in that. They thought their, you know, rights were being infringed on and everything. And, you know, it was just a big issue, and it still is. But again, the main focus is our elders and our youth, and just being a community and being healthy and together. And losing one person, that affects a lot of us, you know, just one person. To people in a big city, that might be nothing, you know, to them, but to us being in this small community, that's big. That has a big impact on a lot of people. So yeah, I just, you know, really like that, the fact that our tribe responded that way personally, because, you know, we do have to protect the people. So now, you know, losing 20 elders, that's potentially, you know, 50 kids that, you know, who's caring for, who's taking care of them, who stepped up, you know. So that's kind of what it looks like in my small reservation community here.
Wow. Thank you for sharing, Diana. I mean, yes, it's, while we're here thinking primarily with girls at the focus, the caregivers and the elders in a community like yours, it's so important to remember what's happening with them because it has knock-on effects for girls and everyone else in the community. I think that sense of loss is just going to continue for the rest of people's lives. So I know you have a lot of work ahead of you in thinking about mental health in those communities, but I really appreciate you sharing what's going on there. So I want to, it's so hard to move on in a chat like this because I want to keep going with each and every person and hear more about this, but we have so much richness to share today that I want to keep us moving. So I wanted to focus on one issue that some of you have raised already, which is violence. So one thing that's really come out strongly in some of the recent COVID-related research shows that during confinements and lockdowns, COVID-related violence has really increased. So people are stuck at home, they're frustrated, they've lost their jobs. And the literature is really clear that experiences of violence are strongly connected to poor mental health outcomes. So I'd love to hear a little bit about that from the panel, what your program's experience has been with regard to violence, either before COVID, after COVID. How has COVID increased girls' exposure to violence in the communities where you work? So I wanted to start with you, Christina. So tell me about violence before COVID in DRC and how girls are talking about it and what's the situation they're facing there.
Sure. So we are working in Goma, which is in the Eastern Congo, and that's really the epicenter of the conflict in Congo. And even though that city has been fairly stable, violence has become really normalized and exacerbated by the conflict. And so, I mean, statistically, if we're thinking, the stats show that 50%, close to 50% of women and girls have experienced some level of sexual violence, and norms supporting gender-based violence is widespread. About 75% of girls and women believe that wife beating is justified. And so I think I love thinking about this from a mental health perspective as opposed to just a human rights perspective, and thinking about what that experience is for women and girls to have that constant level of discrimination and violence. Some of the words that I think are important to include are the experience of being undervalued, marginalized, deprioritized, being asked to grow up too fast, and being told in addition that this is kind of just your role in society and what is expected of you. And so I think what it's created is a culture that's not very aware of, for girls, they're not very aware of their mental health concerns, even though this is all taking a toll on them. And in our conversations with girls, it's a process of having girls become aware of their own mental health and how to express that. Girls are generally, it's easier, the ones that we worked with, it's easier for them to express anger, but not necessarily to identify when they're feeling depressed or sad or stressed out. And so those are all areas that we can work further on.
No, absolutely. Thank you, Christina. And I think, being able to identify emotions in mental health is so critical in the same way that we saw years ago, where sometimes people don't identify things that are happening to them as violence. They just think, oh, no, I haven't experienced any violence. I've been punched and hit, but violence, no. It's you have to sometimes think about the words and experiences that people are having and get at that specificity to understand what's going on when it comes to violence, when it comes to mental health, and really when it comes to just about everything. So I appreciate that work that you're doing. I wanted to hear from Miriam, if you would, and share just a little bit about how you were telling me that COVID is increasing violence at home for girls or for the mentors.
Yes, good morning, everyone. And as mentioned before, I'm Miriam. I work with the Haiti Adolescent Girls Network. So we work with close to 6,000 girls in over 60 communities, girls ranging from 10 to 19 years old, and in some communities all the way to 24 years old in both urban and rural areas. And in fact, the situation in Haiti is pretty much complex, because when we had our national emergency in March 2020, the country was already going through an ongoing political crisis. So with COVID, the situation just worsened, because basically it started in March 2020. And when you think that a lot of times for many of the families, a lot of times they send their children to school in January. So, and it is due to the fact that that they have not enough economic resources, because they are poor families. They are very densely populated areas, and poor areas, and poor households. So with COVID, with the fact that a lot of Haitians from the diaspora, who usually support families in Haiti, usually send money home to pay for school, for tuition, for housing. So a lot of families with COVID found themselves with having to deal with much more pressure. So because of the distancing guidelines, so girls, we have noticed an increase in violence, especially in the case of women and girls. And the reason is there are a number of reasons that explain that. I mentioned the socio-economic situation, but there was also the social disconnect that the other panelists mentioned, because there are so few social networks for adolescent girls and young women that basically we found ourselves losing that physical connections. So one of the things we tried to do to try to adapt to the situation was to get our mentors involved in awareness raising community activities. So that was one opportunity for them, because they already have a presence, they already have a legitimacy in the communities. So they had the possibility of visiting community members door to door to promote protection guidelines, distancing measures. So that was an opportunity for them to actually visit the girls on a one-on-one case basis. However, it was clear for us that there were a lot more instances of violence, because what happened is that the role of the mentor is very crucial. They are really at the intersection of the girls they're working with and the families and the households. So the girls, because they are isolated in the households, they find themselves having to deal with increased burdens in terms of house chores, increased verbal and physical violence, because physical violence is such a part of the culture of Haiti, especially with regards to discipline. So there was instances of a lot of physical violence toward the girls, and verbal abuse. Of course, we had to deal with some instances of sexual violence. So that was really the situation for us in the home. And it was really, I have to say, very challenging, not just at the level of the girls that we are working with, but also at the level of the mentors, because the mentors, they are young women working in the communities who have been in one capacity or another, who have been dealing with some of the challenges we know that girls go through during their early and late adolescence. And we also have a responsibility to support them in their role as mentors, as leaders in the communities. So it was very difficult. And even in because we found ourselves not capable of providing the field support that we provide to them, especially in case of special accompaniment, in cases of violence, or in cases that need special support. And another important thing also was the fact that they had to deal, even while they were adapting to the environment of social distancing, of trying to promote COVID prevention measures. They had to deal with a lot of violence, verbal violence from community members who still did not believe that that COVID actually exists, who were very much more stressed and frustrated because of the fact that in some areas, especially in the urban areas where people live on a day-to-day basis, where they could not really have access, go out every day and find ways to actually support their livelihoods. So it has been a very difficult situation. And I have to say that this situation in our case has been worsening over time, because with the political situation worsening, although by early 2021, end of 2020, the distancing guidelines were eased a little bit. We find ourselves, especially in the urban areas, having to deal with incidents of violence in the household, in the communities where especially in the conflict-prone areas, where not only you have communities with gang-related violence within small communities, but also violence that are brought into the households. Because we unfortunately had 3 of our girls who died, who've been assaulted and murdered inside their households. So it is really a very complex situation. Now we are looking at the data, and there seems to be a spike in the cases of COVID. So it is really an ongoing process for us, and obviously mental health is something that is not a luxury, as you mentioned earlier. That's something that needs to be an integral component of our work. Thank you.
Thank you so much for sharing. And I really appreciate all the hard work that the mentors are doing in Hagen. And I know in the Imagine Network as well, and probably others, trying to stay connected to the girls who are in the programs, even through social distancing measures, making these home visits, dropping off packets at home, staying in touch, using whatever digital tools they can that girls may have access to. And the mentors are clearly experiencing huge challenges of their own, and staff are as well. So I think, we have to think about the whole ecosystem of people, and the mental health, trickles down. So you have to, in the next slide, we'll talk about this. So I don't want to scoop myself, but thank you for that. Rima, you had mentioned to me an interesting relationship between men's inability to earn money and how that translated into violence at home. I wonder if you could just tell us a little bit about that.
Sure. So just to quickly describe the current situation in Lebanon, after displacement, refugees had to deal with many challenges, including limited work opportunities. But despite all those challenges, men were still able to work in certain professions such as construction and other professions where they were provided for Syrian refugees. But the prolonged lockdown periods imposed by the government to control COVID-19, it seems that it disrupted the job market and resulted in the majority of Syrian refugee men losing their jobs. And it came at a time when the country was already experiencing a financial crisis and inflation and a huge spike in consumer good prices. On the other hand, and interestingly, it seems that the agricultural sector that usually hires Syrian refugee women and children was not as disrupted as other sectors. So more women and children started working to be able to cope with the difficult living conditions. And all of this created a shift in the power structures within households, in a culture where men are usually dominant. So all of these issues caused additional stress and contributed in an increase resulted in an increase in violence within many households, as reported by many women. So many of women in this community reported that men in their households were taking out their stress on females and children. and the mothers were particularly concerned about the mental well-being of their children, given all those challenges, and especially that education was disrupted. Children were unable to go out, socialize, and play. So this is just briefly to describe how COVID-19 caused an increase in violence, although it was present before, but now it has increased considerably more than before.
No, thank you so much for sharing, Rima. And I think that really shows how everything is connected. You know, young people, girls in particular, are affected by what's going on with all the other people in their lives, their parents, their communities, the broader political and economic situation, and all of it has an impact on mental health at each level. So thank you for that illustration. Anita, you and Anne and your team used the Girl Roster to learn about your community in Kenya just before the pandemic hit. And then you used that information to learn a little bit about what was happening as a result of COVID a few months later. Could you tell us briefly about that process and your findings, especially with how it's related to violence and stress?
Absolutely. I will forever associate Girl Roster with divine timing, because it was in March 2020 when our team leaders went door to door, knocking door to door, gathering information on over 1,600 girls in coastal communities in Kenya. And then at that time, it was determined that 43% of the girls were considered extremely off track, and over 50% of girls in 2 specific villages were at least 2 years behind in schooling. So once again, utilizing that information to help us narrow down where we should be working. Now, if you can think back to March 2020 and what was happening in the world, I was still Googling pangolin, like what is a pangolin and what does it have to do with anything? And what is this virus? And sanitizers and masks weren't part of our day-to-day activity. And so I am so thankful all our team leaders continue to remain healthy, and in general, the people in those communities remained healthy, because COVID hadn't yet hit Kenya. And it was 2 weeks later, only 2 weeks, that COVID hit the scene and the lockdowns began to happen. And in Kenya, the lockdowns came down very quickly. So it was during this time we had the Girl Roster data, and we had to decide what to do next. So it was one of our many pandemic pivots of looking at what our values were and looking how to support trauma-informed community care given the changing situation. So what we did was we pivoted to a mask distribution campaign. So our team leaders had masks on, and they were also distributing masks. And because they had already made contact with many of the community members approximately 6 weeks before, we were able to inquire about deeper concerns like mental health. And so to think about this is only about 6 weeks into the pandemic, but even at that time, and this was a survey of 608 households, 78% had already noticed an increase in conflict. 91% knew someone who was stressed and needed more support, and 56% did not know of any local providers for mental health support. And this is at the very beginning of the pandemic. So we can only imagine now the status. But this all informed the design of our Nawiri Fellowship, which is a program to sponsor community-centered safe spaces based on our trauma-informed community empowerment framework, which allows for high fidelity. So how are trauma and stress and crisis and adversity affecting particularly adolescent girls? And what flexibility do we need to respond to that, to the context of what is really happening on the ground, with a specific emphasis on community care?
Yeah, thank you for sharing. I mean, it's fantastic that you have this data, sobering that it is. You know, it really shows that the things that we're all experiencing in our communities and know anecdotally, you know, it's there in the numbers as well. And, you know, like you, I really wonder what it would look like now after we've all been dealing with this for, you know, much longer than I think anyone expected. And I also wanted to highlight, I also really appreciate your focus on community, because I think we know more than ever now as a result of COVID, what's in your community and what's accessible for you, not only physically, but socially. That's what is the only stuff you have access to. So, I appreciate how the trauma-informed care is being led in a community-centered way. So thank you for sharing about that. I want to move on to our next bit, because I wanted to give everyone a chance to speak. Often in Zoom discussions, everyone has something they want to share, and we definitely want to give people that opportunity. So in a minute, we're going to have a breakout discussion. But first, I want to orient you a little bit about what to speak about when you're in these rooms. So, as we've been hearing from all the panel, what has really become clear under COVID is the interconnectedness of girls' mental well-being, that of their mentors, program staff, their families, what's going on more broadly, and everything. All of that has been challenged by COVID in really explicit ways, in ways that affect different segments of girls, different ages of girls with different circumstances in different ways. So just thinking about the well-being of mentors, Miriam touched on it a little bit, and staff. I've included this image from an airplane flyer, which is a thing I haven't seen in a while, but the importance of putting on your own mask before helping others, and why it's really critical to make sure that staff and mentors are supported, as well as girls, thinking about that whole ecosystem. So I think we have a few minutes actually to hear from the panel, just for a second, to speak about your own experiences, and I'll call on each of you, but then you'll be sent automatically into breakout rooms where you can all discuss these questions on the slide for 10 minutes. But I wanted to just, Rima, one thing you had talked about were some of the learning circles you've been having bi-monthly, and how that's been a space for reflection, and also the responses that mothers of girls have had to some of the mental health things that you have been doing in your program. So I wondered if you could briefly tell us a little bit about that before we break into the breakout rooms.
Sure. So when we started our program, and to make sure, because one of the main challenges in other programs working with adolescent girls was the high dropout rate. So we wanted to make sure that we didn't have this problem. And we did a lot of formative work before we started our program, and we decided to incorporate activities that interest girls, in addition to the activities that we were interested in presenting to the girls. So we, for example, incorporated physical activities such as yoga, exercises that encourage girls to share their own experiences. And after the first couple of weeks, we had a huge positive response from mothers. Many mothers indicated that their daughters were simply happier after coming home. Also, a few mothers expressed that they felt that their daughters were less shy, they were more open. Mothers were particularly happy that those sessions came after a prolonged period of lockdown, when their daughters were unable to go to school or socialize with their friends. So they came at a time when they were highly needed and useful. Some mothers also asked if we can give those sessions two times a week instead of once, and some of them asked to participate in some of those sessions. So we are currently working on sessions that engage mothers as well. Regarding the learning circle, about a year ago, we started a learning circle activity where we invite several local and international NGOs that work with adolescent refugee girls in Lebanon to meetings that are carried out bi-monthly, often webinars after the pandemic started. It's just a platform where we informally share personal experiences and challenges and learn from each other. So each meeting has a different theme. For instance, we discussed at the beginning of the pandemic, we discussed challenges encountered when executing programs in humanitarian settings, given the lockdown and all the challenges that came after the lockdown. In another session, we had a guest speaker who discussed the best way to involve men and boys in the Syrian refugee community in a way that supports programs for women and girls. So we found those very useful for all participants, because this platform not only offers the opportunity to share experiences and brainstorm about solutions to common challenges, but it also sometimes it allows exchanging tools and resources or collaborate addressing a common aim. So the activities introduced by each NGO complements each other sometimes. And this is especially important in a low resource setting that is facing many challenges, such as in Lebanon. So this is just to briefly address your two questions.
No, fantastic. Thank you so much, Rima. And, you know, I think these types of learning exchanges are more important than ever as things are changing so rapidly and programs have to move online or have to deal with challenges that weren't there before, in addition to all the challenges that have been ever present. It's important for groups to have that space to reflect and to learn from each other and to share tools, share what's working, share what's not working. So, you know, that it's fantastic that that's happening, and thank you for describing it for us. So I'm going to have Sam send everyone into some discussion breakout rooms for about 10 minutes. And, you know, you won't each be able to address everything that's going on, but just to think and speak a little bit about how and when mental health needs present themselves in your settings, in your programs, among girls, staff, mentors. How are you identifying those needs? And what you're doing to address those needs, things that are working, things you've tried that are not working. We won't really have time for a formal report back from all the groups because we have so many people, and I'm sure there'll be so much richness in those spaces. So I ask that someone please be the rapporteur for each group, or every group, make sure you get your notes in the Google Doc that's just been shared again in the chat. So please make sure that all the richness in the meeting that you have now for 10 minutes is not lost. We'd love to have it somewhere, and it's not just going into a void. We're going to make a document that will compile some of those learnings as well as the things that have been discussed today through the panel. And then we're going to come back for a little more discussion after. So please don't leave us. You can always sit quietly in the breakout room, and you don't have to participate, but we hope you will. So Sam, if you could please automatically send everyone into the rooms now for 10 minutes, and then we'll be back soon. Thank you. Thank you all for your participation. So I wanted to give just a few minutes. We have 15 more minutes in the session, and I want to highlight a few of the things that some of the practitioners in the community of practice have been doing to address mental health challenges for girls, mentors, and staff in the low resource environments where they work. So first, I'm going to hand it over to Christina to talk a little bit about the things that you're doing in DRC. And I think you have 3 slides here, so just tell me when to advance to the next one.
Okay, great, thank you. So I just wanted to start with, from the perspective of trauma-informed care or neuroscience research, and how our brains, when they are under stress, the parts of our brain in the neocortex tend to shut down, and we go into survival mode, and we're not able to therefore do things like plan, imagine, exercise control, and logic. And so this just really highlights that if someone is in a stressed out space, it's important that that's addressed before they can move on and engage in learning other hard skill sets that we know are also important to teach in the programs. And so we think it's really important that there are time is taken for girls to experience calm and to process their emotions. We do have a range of art activities and expressive art activities that we do in the programs. I think the arts are a really great way to engage with mental health for adolescent girls. It's they have therapeutic benefit, but are non-stigmatizing. You can do them as an activity without talking about it being a mental health issue. There also, arts are found in every culture, so there's a lot of ways to make the activities contextually appropriate. And it's a very natural fit for the adolescent age. Adolescents really gravitate towards creativity and artistic activities. And it's something that can be done in group settings. So one of the things that we recommend and that we do in our programs is building one asset of being able to identify and express emotions. And in this particular exercise, which I'll just briefly explain, the purpose is for girls to develop a greater emotional range of expressing their emotions, because they might not have any experience with expressing an emotional range, and that's really important for their mental health. So in this exercise, it's a musical chairs game. Everyone has a specific place except for one girl, and then music's played, or you can, if you don't have a radio, you can create your own music. And when the moment comes that everyone needs to sit down, one girl doesn't have a seat, and she is asked to do, just kind of put on the spot to do either a small or a big gesture. So you can see on the right, a small gesture, on the left, a big gesture accompanied by a sound. And it's just practicing getting into a spontaneous moment where the girl can practice expressing different range of expression. And the one on the left is really always strikes me as powerful because this girl in our program, Aziza, I've never seen that expression on her face except for in this exercise. Otherwise, she's very uncomfortable in group settings. She had less education than other girls and was just very timid and shy. So this is, an effective way to engage emotionally with girls. If we could go to the next slide. And then another thing that we recommend, there's different activities that can help girls self-soothe and calm. So in this particular activity, it's a doodling activity where you need pen and paper, but again, those are pretty basic and usually could be accessible. And the reason why doodling, even though it's very simple, is effective is it taps into, it's a kinesthetic activity and a rhythmic activity, and it taps into the areas of your lower brain that might be on high alert in stress, and allows you to calm down and focus. So there's a whole movements around Zen doodling and the value of doodling. So this in particular is a group activity where there's relationship building happening with the doodling. If we could go to the next slide. And they end up creating beautiful artwork for one thing, but also it's a very simple exercise and it's calming. So, and these are part of a collection of resources that are available on the Community of Practice website.
Great, thank you very much, Christina. And Rima, I don't know if you want to speak about this slide or just the next couple, but you have the next few slides to give a few examples from your program.
Sure. So actually what I was going to talk about overlaps with what Christina was describing. What we found very useful is providing safe spaces where girls can meet and socialize is in itself very useful. And it gave the girls a platform to share their experiences and fun activities. Incorporating, we try to incorporate exercises that allow girls to be creative, like drawing activities, role-playing activities. It also helps them to express their emotions, as Christina mentioned, as it is a really useful way to vent off and express themselves, and it's something they're not used to do in their communities. We incorporated sessions that teaches them indirectly on how to manage stress and anger and how to communicate effectively with adult members in their family. We encourage them to have at least one adult member or two adult members of their family or their community where they can seek help from if they are facing problems, someone they trust. In this particular photo, the session was to understand how much girls were aware of their local community. So we asked them to draw their local community. to understand the awareness and connections to resources in their local community, and to understand also what services are accessible or inaccessible to them, and what kind of services girls their age need. So in order to work on connecting girls to such services. Next slide, please. So one of the things we recognize early in the program is the importance of incorporating physical activity. And as you can see from this photo, this was a yoga session, and it was hugely popular among girls. So we made sure to introduce different types of physical activity in different sessions. But yoga was really popular among girls, and especially married young girls. In our program, we included 13 to 20-year-old married girls. And they found yoga and breathing exercises to be really useful to control their stress and to improve their mood. Next slide, please. Mm-hmm. So yes, as I mentioned, those are briefly the activities that we introduced. And so far, even mentors themselves are noticing the difference in girls session after session. So it's very encouraging that so far our program is contributing to improving the mental well-being of those girls.
No, absolutely. Thank you so much for sharing. I think that we have covered what was going to happen on this slide, so I'm going to move to the next one. A final area I want to briefly touch on is measurement. So one challenge is how to measure changes in mental health. There are a lot of scales out there for things like depression and resilience, but there's not a lot of international comparability. There's no agreement on what's actually appropriate for girls, especially the types of marginalized girls that we've been talking about today, how well they translate. So I wanted, Anita, if you could really briefly tell us about the biological measure you've been using and why you think it's important to test out supplementing some of these typical scales with a biological measure.
Absolutely, because how do you measure what you don't know? As multiple people have discussed, many of us are not aware of emotions, and we don't have language. There's not that mental health literacy to identify how many times in the past 7 days have I felt happy, angry, or sad. So we felt it was important to supplement our evaluation with physiological measures, body-based measures. And the way we do that is through an indicator of heart rate variability, which is the time in between heartbeats. We are so thankful to have a research partner at the New School for Social Research and their trauma and affective psychophysiology lab. It's a very fancy term for saying how our bodies impacted over time by stress and trauma. And the heart rate variability is a very simple module. It's just a little ear clip that attaches onto the lower part of the ear where you think an earring would go. And we usually introduce it about the second or third day of our training. And it gives an indication of nervous system health. So are we able to ramp up when there's a stressful situation? We should be able to act. And are we able to relax when there is not a stressful situation? So heart rate variability gives an indication of that. And it's a great measurement to track over time. And once again, we use it to triangulate with qualitative data and other written assessments. Because it is a body-based measurement, it takes a little bit longer to make a shift. And we're not surprised on time point 2 for the written measurements if the indicators are a bit worse, because sometimes at baseline, people aren't able to answer the questions truthfully. But the body, there's a thing, the body keeps score and the body does not lie. And so we were thrilled that over time, our participants were able to consistently increase their heart rate variability. So they were able to have better emotional regulation, decrease their critical heart stress. To give you an example of the indication in South Sudan, this was not specifically with adolescent girls, but our providers were between 20 and 40 years old and had 35 years old was the average age. They had the heart health of 90 years old, 90, because that is what stress does to bodies over time. And with the Population Council and the Girl Roster mentorship, we're getting better about collecting segregated data and focusing now specifically on adolescent girls. And this measurement of HRV does work across cultures and across ages.
Thank you, Anita. Yeah, it's really interesting work, and I'm excited to see how it plays out, especially with like the girls who are the focus now. So I know that we're coming up on the end of time. I wanted to get final thoughts from each panel member very briefly. If we could dream together for a minute, if you had more resources and more time and you could do more in person, what would you want to do next? So Rima, I'll start with you.
Sure. So actually, I wanted to discuss something that was also brought up when we were having a discussion in the private rooms. I would definitely invest in capacity building, in proper training activities for our mentors. They are doing very well, but we have to keep in mind that they are recruited from local community, and they are not necessarily properly trained in dealing with delicate mental health issues. So, and since this is a common problem, I would love to have someone, a professional, to train them on how to approach such issues. Recently, when they encounter delicate mental health issues, they refer back to us, and we work on linking those women to the proper services they need. I would also love to invest further in creating a network of community workers or mentors that work in different areas in Lebanon. This is particularly important given the high mobility of refugees. In our program, many girls and women are leaving because of the high mobility. At the same time, they are interested in continuing learning and continuing benefiting from our program. If we had a proper of community workers in different areas where there are high numbers of refugees, maybe we can create a network where women who move from one area to another can still attend this program without causing much disruption. So this is like our main aim, and if we have additional resources, we would probably invest in this.
Great, thank you very much, Rima. And for everyone still on the line, thank you. I know we're at time now. I'm just going to give another minute or two to each one of our panelists to say their final thoughts, and then we'll wrap up, but we're not going to just go all day. So if you could stay with us, we'd very much appreciate it. And I want to give some space to the rest of the panel. So Miriam, if you have any final thoughts about either of these two things, the key lessons you've learned or what you would do in the dream scenario.
Thank you. I'll just maybe focus on one key thing that encompasses all the specific things that I'd love to do if I had enough resources, would be really to promote a culture of mental health as an intersectional asset to building resilience, not only for girls, but women, youth, and families towards developing a culture of peace, especially for Haiti. Thank you.
Thank you very much. Christina, what about you?
I think, definitely more capacity building for our staff on the ground and mentors. And also, I think a really interesting area that can be explored more is what Indigenous practices are there in various cultures that can be integrated into these girl space activities that we've been doing. So I think that's a really interesting thing I'd like to explore more.
Wonderful, thank you. Diana, what's your response to one or both of these questions? Or if we've lost Diana, I'm not sure if she's still here.
Hello? Hi.
Yes.
Okay.
Okay.
Sorry. I'd like to provide more cultural resources for our families. Cultural loss was a big thing in the 50s and 60s and 40s. So just revitalizing all of those things. One of the things that I wanted to do was have a family smudge kit for each of the families on the reservation. That's just one of the things that they could do together, is smudge in the morning and smudge at night, or smudge when they're not feeling good. So that's one of the cultural practices that I would like to see revitalized in each of our households.
Wonderful, thank you. Kelly, do you have any additional reflections from Imagine's perspective broadly?
I do, yes. You know, the in-person training is really critical, and we have not been able to do that. We have been meeting twice a month with all of our mentors across the network, so that has been extremely helpful for them in terms of both just breaking the social isolation, but also helping each other come up with ideas on how to connect girls. And, you know, things like cooking classes, self-defense classes, beading have been really popular with girls, and they've really gotten good ideas from each other. But further, I think moving beyond just trauma-informed approaches to healing-centered approaches that really focus on strengths and not deficits. We don't want to say, oh, what's the worst thing that's happened to you, right? We want to say, these are things that can really help heal, provide energy, power. So that's really where I want to move in Imagine.
No, that's fantastic. Thank you, Kelly. And I always also want to highlight that positive side of everything, the focus on power and healing, and not just on the deficits and all the things that are wrong. Anita, do you have any final reflections on either of these questions?
I do, and it changed in response to Kelly's answer, so thank you so much. Not just what we're moving away from, but what we're moving towards. And we added a component of joy into our model, because it was always part of our process, but to intentionally create joy and opportunities for girls to thrive.
No, thank you. I love that we're ending on this positive note. You know, we've talked about a lot of heavy things today, and I thank you all for sharing and participating and talking about all the really difficult things that have been going on in your communities and with the girls that you work with. I just want to close by saying we don't have time for Q&A in the session because we're already over time, but I hope that if you have outstanding questions, you can put them in the Google Doc, and all of our panelists will have access to that as well to respond. But I thank everyone so much for participating in what's been a really rich session. You know, we heard from people working in programs in a huge range of really challenging environments, and talking about how the mental health of girls and mentors and families and communities have really been stressed, but also thinking about approaches that work, that are culturally appropriate, that build joy, that build resilience and the strength that girls and mentors and communities need, that are culturally appropriate, locally tailored, and also in low resource settings. You know, we're not talking about things that necessarily require huge investments. There are things you can do if all you have is your body, or maybe you have a stick and some dirt, or one crayon. There's so much you can do, things that really have powerful effects for girls and for communities. I think that everyone in what you've spoken about today really show those linkages between mental health and the social, economic, environmental determinants of what's going on, and how critical it is to address these directly, and how doing so in culturally appropriate ways can work on these broader determinants of mental health, while also, doing things that specifically focus on naming emotions, feeling emotions, knowing what's happening in your own body and in your own life. So all of you are working on the types of programs that girls who are marginalized need, the ones that help them thrive to be who they are, where they are, and supporting the mentors and staff to deliver these programs. It's really critical work. And I know that we're also working on those root causes that are out there, so that we can build neighborhoods that work for everyone. So thank you all so much for sharing. I ask all the participants to please share in the Google Doc any tools and resources that you'd like to share with others. In the coming weeks, as I mentioned, I'll be compiling notes from the discussion here and from the things that have gone on in your breakout rooms. And so I'm hopeful that this is not our only time to reflect on mental health and that we can come together as a group again sometime soon. But thank you all again, and wishing you good mental health in the rest of your day.